what is the backbone? What is the framework of really excellent skincare at midlife? So just putting the estrogen aside for a moment, what do you think are like the most important things you want women to know who care about their skin now?
For me, I have certain things that I call my non-negotiables. I
Yeah.
think that virtually everybody should be using some form of retinoid,
Yes.
preferably tretinoin, which is prescription strength, but there are over-the-counter retinols and retinaldehydes that are also useful, though maybe not quite as useful as tretinoin. I think that using antioxidants is helpful because they help mitigate the effects of the sun, they help brighten the skin and things like that. And the things that have been studied seriously are retinoids like tretinoin, vitamin C, which was studied back in the 90s by Sheldon Pennell at Duke with clear scientific, evidence that it works. And then there's something that I'm passionate about, which is called DNA repair enzymes. And those are a really interesting class of topicals that were originally studied in patients with a disease that's called xeroderma pigmentosum. Some of you may know what that is. It's a genetic disease where these kids can literally not go outside. By the time they're 8 years old, they have 500 skin cancers. And it's really a terrible thing. If they look all freckled, it's terrible. And they've studied these enzymes in those patients, and they've been shown to reduce the incidence of pre-cancers, not melanoma, but non-melanoma skin cancers and pre-cancers by about 30%. So for me, that's something I really think of as a maintenance thing that you start when you're young. There's no irritation, there's nothing. They're in all kinds of formulations, serums, creams, lotions, you name it. And you use that as part of your skincare routine. So for me, and then sunscreen, I'm insane about that. And I've given my own talks on the sunscreens in the United States sunscreens versus European. That's probably not the perfect, this is probably not the perfect venue for discussing that, but we can always get into it a little bit. So to me, retinoids, antioxidants, DNA repair, and sunscreen. And then if you need to put a moisturizer on top, sure. I tell patients, it's like, look at Dr. Menn. She's wearing a blouse and then she's got her blazer. You want to just wear a blouse? That's fine. You can't go out without your blouse unless you're, what's her name? Mackenzie, whatever her name is, Jeff Bezos' girlfriend. But otherwise, add a moisturizer. If you still feel dry, sure, but that's not your workhorse.
Yes. Yeah, your workhorse are those tenants, the tretinoin, the
Antioxidants like
and
vitamin
yeah, the
C,
vitamin
right?
C and sunscreen. And then what you added at your lecture and you always talk about is then like we've got really good science that topical estrogens can be a nice add-on integral part of that regimen, right? So getting back to like, so how does tretinoin, we get this question all the time, how does tretinoin work? Let's just work. And then how does it work differently or complementary with topical estrogens? What do you think about that?
Tretinoin is a completely different compound. It's vitamin A, okay? And
Yeah.
it works very differently. It works mostly in the epidermis, but also in the dermis. It helps to increase the rate of cell turnover. It helps to increase angiogenesis, which is blood vessel formation. And blood vessels are what feed the skin with everything it needs. So that's really what it does. It has been shown to also thicken collagen, but we use topical tretinoin as a way of counteracting majorly photo damage from the sun. It helps with pigmentation and helps make the skin look smooth, lessens the roughness, and there could be a little adjustment phase when you first start it. As topical estrogen is a completely different process, okay? And very interesting, it doesn't seem to be all that helpful in photo damaged skin. That's important. There have been a few studies that have looked at this and found that in sun protected skin, or in people with mild to moderate sun damage, but severely sun damaged skin, you're probably not going to benefit all that much from topical estrogen. So it works totally differently. It works to help thicken collagen, help rearrange elastin, help increase hydration, it help increase even, believe it or not, in like sebum production, help make your skin look smoother. Tretinoin is a completely different process, and that's why you using them together is a great idea.
So, and we often get this question about, kind of on the lines of the tretinoin, because with the topical estrogen, we have like one dose right now that we, are offering. It's, has been studied and we feel good about. But tretinoin does come in different doses. And sometimes patients are like, more is better. I'm like, no, so for a tretinoin naive patient, right, someone who's not really used it before, what is your advice on
Well, it
entering
depends.
into your
It
regimen?
depends on the person. So I
Yeah.
have some patients who are totally averse to one flake on their skin. If they have a moment of dryness, they're quitting. So if you start tretinoin in any strength, and tretinoin does come in different strengths. It comes, the lowest is 0.01, and then it goes to 0.025, and then it goes up to 0.05, and then it goes to zero point 0.1. Okay. The studies on photoaging skin have been done for the most part with 0.05. Those are the most studied percentages. But
Okay.
what we have and by the way, let me just say that tretinoin is really an acne medication that was brought on in the 50s by Dr. Kligman, very successful. But back then, there was only one strength, and I believe it was zero point 0.1. And it made people sunburn, and that was a real big problem. But from what my research has told me, there was something in the base that seemed to inactivate one of the sunscreens, or the only sunscreen that was used back then, which was called PABA, which has long since been
Yeah.
taken off the market. So patients don't really get sunburn when they're on tretinoin as long as they are using sunscreen. And that's what you have to do. So I don't take responsibility if people are using it and we tell them to use sunscreen and they don't. It's just a fact of life. The most common reason for stopping tretinoin is poor instructions on the part of the doctor, or my least favorite word, the provider. I hate that.
Yeah,
And
we
you
don't really like that word.
I
I know.
hate
So
that. I hate that.
I get lazy and use it sometimes because it's everywhere, but I really don't like it. Um, I prefer clinician, doctor, physician over provider.
Right.
I'm with you
Correct.
on that.
Correct. But you
um,
start
yeah,
very slowly. And if you start very slowly, you'll get very little irritation and you
yeah,
build up. I tell patients start every third night. Then when
yes.
you're not so dry, go to every other. And then eventually you get to every night and you should be able to tolerate it. To your point of less is more, probably true, but there was a one really good study that was done where they used the strongest percentage of tretinoin, and people got red and irritated. And if they persevered for 2 to 3 weeks, all of that went away. So I use the analogy, it's like starting at Barry's boot camp. If
You're
you
sore at first.
you get sore and then you're not. So it's the same
Yeah.
kind of thing. But generally, I recommend that people start at 0.05. And if they're scared to start prescription because who knows why, then I'll let them use an over the counter and kind of build slowly and get used to it and then get them up to tretinoin.
Yeah. And then in terms of the layering of these, so you've mentioned vitamin C, you've mentioned DNA repair, you mentioned um, obviously tretinoin, and we've got our estrogen. So if people are using any or all of those things, what is a common sense daytime, nighttime approach?
Here you go. This is pretty easy. Tretinoin is used at night. There are some forms of retinol that aren't photostable, so forget about that. You only use it once a day. That's part of your nighttime routine, okay? And I say layer thin to thick. So put your thinnest product on first, wait a few seconds, let it dry, put the next one and the next one. So usually vitamin C is the first product to go on because most of them are very lightweight serums. There are some forms of vitamin C that come in creams and they're heavier, and then it's up to you. So I usually will have them do a vitamin C and
In the
then
morning, right?
in the
I'm
morning.
sorry, daytime, right? Okay.
Right, this is daytime. And some people advocate using vitamin C in the morning and at night. I'm not one of those people. I feel that it's most helpful when it comes to sun exposure. So, and that doesn't mean only at the beach. That means you go outside your house to go to work or to the playground or wherever you're going. That's a good time. So I say I have them use vitamin C first, and I have them use their DNA repair product, which is often a thinner serum too.
Yes.
And then they can put their moisturizer if they want, and then they put their sunscreen on. And if you're going to use topical estrogen, then that could go in place of the moisturizer or before it if you really think you need that. That's how
Yeah.
I.
Yeah, that's how I use it in the morning. And because of you, I'm also using the DNA repair. I've tried the
Good.
two of the brands. I'm experimenting with different brands at your
Good.
recommendation. So anybody who's listening, go. Dr. Gendler has some great videos on that, reels on that on her social media and on your TikTok, I think.
But can I
So
say one other thing also that I
yeah,
think is important here? The difference also is that with tretinoin, you can sometimes actually see yourself the difference. There might be brown spots that go. There could be even some precancers that go, and you can actually see that your face looks clearer. There may be fewer lentigines, age spots, and you can visualize it. With DNA repair, and really, I believe with estrogen creams as well, it's more of a preventive thing. This is something, it's maintenance, it's going forward. You're not really trying to fix a specific problem, okay? With tretinoin, you really are trying to counteract sun damage. That's what you're trying to do, or acne, obviously. And
Yeah.
case in point, you have acne, you use tretinoin, your acne can clear up. There it is. But
Yeah.
other things are meant to be used for the long haul. So that if
Yes.
you start using topical estrogen at an earlier age when you're just perimenopausal, I hope and I expect that you will look way better 20 years hence than
Yes.
you would have if you didn't use it. And that's what's so important. Really
Yes.
important to me. If you say, well, I used the estrogen for a month and I don't see any difference, the difference is going to be what you see in 10
Over time.
years. If there were a way
Yeah.
people could do it on one part of their face and not the other, that would be nice, but no one's doing that.
Yeah, that's really interesting. And it's honestly basically the same thing that we talk about in terms of systemic hormone therapy. We talk about a timing hypothesis, right? Like when we give, the data and the evidence, not that it's not FDA approved for heart protection or dementia protection, but we do have plenty of data that if we started early in that ideal window, we're going to have all of these benefits that kind of are hard to see until down the road, that you just didn't develop all those things down the road, right? So kind of shoring things up while you're at this vulnerable time and then continuing on for maintenance is this kind of idea, right?
Right.
And this is why a 20-year-old, really, frankly, it's not going to hurt you, but a 20-year-old doesn't really need topical facial estrogen, in my opinion, right? It's for when you're having that time of that initiation, that vulnerable time of perimenopause, which can be up to 10 years prior to your last period. But when you're starting to notice those changes,
Right.
that's a reasonable time to incorporate it into your regimen.
Right.
Right?
And if you start when you're 60 years old, you're not, you have to realize you're not going to see dramatic differences. You're not going to suddenly say, oh my God, look at my eyes. They look, it looks like I had surgery. That's not going to happen. But if you
and it's interesting because and sometimes we have like 75, 80-year-olds come and they want it. And I said, that's fine. You can have it. It may help with, like, maintain some moisture and help, but it can't completely reverse stuff that's happened. But then they say, but why does it reverse stuff in the vagina? I'm like, because your vagina didn't see the sun. Your vagina doesn't have photo damage, right?
and it doesn't have an epidermis, right?